Hello friends, welcome back to my channel. In today's video, I'm going through what is in my clinical bag for anesthesia clinicals. If you don't know, obviously you probably know by the title of the video, or if you've watched any of my other videos, I'm in nurse anesthesia school. I go to clinical 3 days a week, 10-hour shifts. Usually I'm there more like 12 hours, but typically my shift is 7 to 5, but I get there like 5:30. So in my last video, I did a week in the life video where I took you through some of my clinical days and just how my weeks look. Someone commented on that video asking what I keep in my clinical bag, so I thought that would be a really cool video idea. I actually did one what was in my nursing bag from back when I was a nurse, and people seem to really like that, so I thought it would be fun to go through and do one for my clinical bag. There's really not a ton that I keep in it, but I thought it would be fun to go through it with you anyway, because a lot of what we use is actually just like in the OR. So I think maybe eventually I'll do a video like what I use, like common tools I use in the OR. That might be cool. If you want to see that, give the video a thumbs up, comment below, or just any other videos that you think would be interesting or things that you're curious about when it comes to anesthesia school. So I actually have two bags that I bring with me to clinical. I have, if you watched my last video, you would have seen I have my fanny pack that I wear all the time when I'm there. I keep my badge on it, and then it just clips to the side. And then I have my stethoscope clip that I keep on it too. I really like doing that instead of keeping them on my actual scrub bottoms, because it just, I don't know, it's just more comfortable, it's easier, I always know they're there, and it's like a safe place to have them when I'm at home. And then I also bring an actual backpack just to keep other random stuff that I might need. So we'll go through what's in the fanny pack first. I actually had a CRNA that I was with make fun of me for wearing the fanny pack, and I'm like, listen, I don't wear it outside of the hospital, but it's very useful here. Do I occasionally wear a fanny pack outside? Yes. Is it this one? No. But that's besides the point. So first thing, okay, so there's a couple little pockets. There's like a back pocket, middle, and then a small one. In the front small one, I just have a ton of extra pens. So pens, you need pens all the time. I do paper charting at the hospital that I'm doing clinical at, but most places are computer, but regardless, you still need to sign things, write things, whatever. You always want to have lots of pens. Another thing is a Sharpie. So I use this to label when I draw up medications and syringes, to put the date and time on them, things like that. And you'll just find you use, I don't know, you label, if you make like a phenylephrine drip, you need to label it. Just very helpful. Something not a lot of people have, but I love, is having scissors, because I find that you just use them for a bunch of different things. And a lot of people in the OR will randomly be like, oh, does anyone have scissors? Yes, I do. So you get good points for being a prepared student if you have your scissors. I don't have hemostats. I use those a lot as a nurse. I feel like you can find hemostats in the OR if you need them, but I've never really feel like I need them. I have my little notebook. I had like a little mini legal pad one that I really liked, but I lost it. So this was like a mini composite book that I just ripped the front page off of so that I could, I don't like having to open it and do it. I like it just, I can just pull it out and see my information. So when I'm looking at my assignment in the morning, I'll write the anesthesiologist that I'm with, the CRNA's name that I'm with. I'll put the patient's names, if they're male or female, because that is big with your setup of what size things that you're gonna need. I put the surgery that they're getting done and the surgeon, because it's nice to just be able to look at it. And I write my cases for the day. Sometimes it changes, but I like just having an idea in my head, and then it's good because you can discuss your plan with the CRNA if you already know like what to expect for the next case. You don't have to keep syringes in your bag, but I do, because they're in your rooms, but I like to have extras in here, because sometimes you'll go to a patient's room and you go to pre-medicate them with Versed or something, and if you didn't remember to grab, if I didn't remember to grab a syringe, at least I know I've got some backups in there. Usually I'll put them in at the beginning of the shift and take them out if I don't use them, but I forgot, so that's good because there was one in there for you to see. And that's pretty much what I keep in here. I also keep, I have them just in my regular bag for now, but so we have to chart in Typhon. That's the program that tracks all the cases we've done. So I have little sheets that basically say the patient's gender, age, what ASA status. I put the medications that I gave during the case, what time it started and stopped. And this way I know when I go home to chart my Typhon, I have everything that I need to chart, and I'm not trying to think, oh, what did I use for this specific patient, or what ASA were they? It's just already there for me. So it just I have a couple sheets, so I think I can do like 4 on here, and if I do more than 4 cases, at least I know what I need to write down. I also we have to do care plans every day on a patient, so usually just 1 case of the day you pick to do a care plan. So I have just the first page of a care plan printed out, so that has the actual patient information that I need, like the specifics, and then I can fill out the rest of the care plan based on that. But this way, when I'm doing my pre-op, I can just transfer over the information I need, and then when I go to do my care plan, I already have kind of the first page done. I just have to type it in. And then finally, I have just a blank eval, because we have to get an eval signed by our nursing or CRNA preceptor every day. So always have those on deck. So I'll usually keep these 3 papers in the fanny pack, and then once I don't need them, if I have them assigned before I go to lunch, I'll just pop them in my backpack, but I have them in my fanny pack ready to go. So that's it for what I keep on me all the time. In my actual bag, priority number 1, breath mints, because you're up close and personal with everybody in anesthesia. You got the CRNA right here, anesthesiologist right here, you're in the patient's face. It's just, you don't want to have coffee breath or breakfast breath, whatever. So I always, when I finish my coffee in the mornings, I'll eat a mint. If I eat breakfast, eat a mint. Keep it fresh, you know? I don't really wear a scrub cap. I think if you watch my last video, you see I just put the bouffant on, but I do have my little Sharky scrub cap if I do want to wear it for some reason. I did find, thank you for the suggestions for scrub caps, I did find a couple that I'm going to order that I really liked, because after I leave this rotation, my next one, I don't think the students are required to wear like a colored bouffant to show that they're a student, so I should probably have actual scrub caps so that I look a bit more put together. In my backpack, I keep my drug cards, so this is just a quick reference. I honestly know most of what's in this because I just took anesthesia pharm, and you have to know all of this off the top of your head anyway, but if there's something random I need to look up, at least I have my book. I printed out just a sheet of like common ventilator settings, just as I was learning kind of what modes were good for what. I really know this now because I've been doing it so much in clinical, but it's at least there if I wanted to look at it. That's more of something that I just did originally. And then this is something that I highly, highly recommend if you are starting clinicals doing something like this. So you have your mnemonics that you can use. There's like MS maids, things that you refer to when you're setting up your room to make sure you don't forget anything. But I still, even with that, wanted to make sure I was covering all my bases and I wasn't missing anything in my room setup as I was getting started. So I have, if you can see it, it basically is my room setup where I have the mnemonic set out, but then everything that I need within that. So for machine check, I have that I need to do the check that's actually on the monitor. I need to do the sensor check my tank pressures, my leak checks, and then everything I need for suction, the different monitors that I need, everything I need for airway setup. So, you know, if you go through the mnemonic, it's just airway, just a blanket airway statement. So what do I need within that? I need my blade, my ET tube, if I'm gonna use an LMA setup, oral pharyngeal airway, so an OPA, bite block, tongue depressor, things that I can have out ready to go for my airway setup, and I just didn't want to forget any of that. And then things I need for IVs, the drugs that I'm gonna, that you typically use, and then just anything additional special, so like my eye tape, my tube tape, an OG tube, and all that's just case specific, but I found that it was really helpful that I could quickly look at this before I left the room in the morning after I set it up to make sure I really, really, really wasn't forgetting anything. And then just to help get a routine down as well, I made a little patient in-room setup, not in-room setup, like an in-room steps list for how it typically goes when you wheel your patient in. It's really things that help me get into my flow. So I want to kind of do things in the same order as much as I can so I don't forget anything. So it's basically when you get in the room, write down the in-room time, move the patient over to the OR bed, obviously, attach the blood pressure, make sure I hit start, so like automatic start, attach the pulse ox and leads, pre-oxygenate the patient, and then they'll get the meds, make sure that they're asleep, so you check like an eyelid reflex, and then tape the eyes, ventilate, and then under ventilate I have things like check the APL valve, put in the OPA if I can't ventilate them properly, look for condensation in the mask, just things to assist me with that, and then intubate them, inflate the balloon, give a breath, look for condensation, make sure you have end-tidal CO2, listen to breath sounds, switch over to the vent, open the APL valve, and then turn on the gas, turn flows down, and secure the tube. So all of this becomes second nature. It becomes things you don't have to think about. You just know that you have to do them. But as you're starting, it's so helpful to, right before you go in the room, if you have a little time, just just go through this as many times as you can. And that's kind of what I did to really get my flow down in the morning. So I don't use this anymore, but I still have it in my backpack. It's just something that I highly recommend, writing out your steps and keeping this just on the anesthesia machine so you can quickly look at it if you need to, and then let your CRNA know as well that you're the CRNA you're with, that you're prepared and that you're trying. So even if you do miss something, it shows like you're working on it. So highly recommend doing something like this. And that's pretty much everything that's in my bags. Usually I'll keep my keys and wallet in here too, but you really don't need much for things that you actually bring. A lot of what you use is actually already there. Like I said, I'll go through in another video things that I commonly use in the OR, but that is what is in my anesthesia clinical bag. Thank you guys so much for watching. If you like this video, make sure to give it a thumbs up and click subscribe. I'm going to try and vlog this week, do another weekly vlog. But yeah, thanks for watching. Bye!